Good morning. Good morning. Yeah, okay, good. We're still here. Good. It's great to see everyone. My name is Lyell Jones. I'm a neuromuscular neurologist in Rochester, Minnesota. And it's as always, a sincere pleasure to be here, partly because this is obviously a beautiful setting, partly because every year when I look through this program, I am consistently impressed with not only the quality of the folks that are speaking with you, the design of the content is very timely, very appropriate, and so I really feel honored to be included as a part of this group. So for those of you who have been to this course, who's been to this course before in prior years? So I've redesigned this talk a little bit from the perspective of how to make it useful for you. I want this to be a useful talk for you in terms of diagnosing and managing painful peripheral neuropathies. The idea there is not so much that there's a lot new under the sun in terms of peripheral neuropathy, but neuropathy is an important thing to talk about, which when I'm on the title slide here, I always like to ask myself, why are we here? And that sounds like a rhetorical question, but really, why are you in here? Have you seen the outside today? I mean, it's absolutely gorgeous. Hopefully I can keep you engaged long enough to keep you from running for the exits. But why is this relevant? And I'll just have my disclosures here for a minute. Neuropathy is common. We have learned over the last few years how common neuropathy is. The prevalence of peripheral neuropathy is probably about 1.8 to 2% of the population. So this is common. These are common things. We also know from some work that Dr. Watson, who you're going to hear from in a minute, he's a co-investigator on a recent paper that defined the use of opioids in patients who have peripheral neuropathy. And it won't surprise you to hear that patients who have peripheral neuropathy are 3 to 4 times more likely to be on chronic opioid therapy. Very timely topic. So we're going to talk about neuropathy. I don't have any relevant financial disclosures here, except for a board review book. And these are all the medicines that are approved for the treatment of painful diabetic neuropathy. Everything else will be off-label. So this is what I'd like you to be able to do before the end of this talk. And from a more pragmatic perspective, we're going to talk about how to think about neuropathy, how to organize our thoughts around neuropathy. But really there are 5 or 6 questions that I would like you to be able to leave here today and be able to answer when you get back to your practice on Monday morning, probably most of you. So what is a peripheral neuropathy? When should